I'm Dr. Ramsey Choucair. I born and raised in a small town in West Texas, original Texan, and grew up in there and went to Rice University. And then after graduating from Rice, I went to the University of Texas Southwestern Medical School and got my medical degree. And from there decided I definitely wanted to be a surgeon. So in that era we did 5 years of general surgery training and were completely certified in general surgery before we went on and did a second residency in the field of plastic and reconstructive surgery. So I spent 2 more years after the first 5 of general surgery, after 4 of medical school, in plastic surgery training at Ohio State University. And then after finishing plastic surgery residency, I wanted to get additional training in cosmetic surgery and aesthetic surgery. So I did that on the East and West Coast, and then finally did another fellowship in burn reconstruction because it was one of those things in life where that you had the opportunity. Here we are back in Dallas, been practicing here for the last 18 years. You know, I became a doctor primarily because as I went through college, recognized that, you know, the science and the human aspect was something that I thought would be something I could enjoy for a lifetime, and it's turned out to be very true. The opportunity to take care of someone and them put their trust in me is quite humbling. I think about that every day. You know, to do something they don't have to do, yet have the trust in you that you're going to accomplish that and take care of them as if they were family. So that actually is what generates the motivation and excitement for what I do. And each time you take care of someone and they have hopefully the outcome they desired because you've communicated effectively with them and you've talked to them and you've got to know them, it's become really what keeps it going. My practice includes both body and facial cosmetic surgery and of course some reconstructive surgery because I still enjoy doing it, but 95% of my practice is either doing body aesthetic or facial aesthetic surgery, facelifts and tummy tucks and breast lifts and breast augmentation, and that's the focus. Many times patients will ask what to expect when they come to see us, and I think that's a very important question. I think basically that what they can expect is, first of all, to be treated very confidentially and with great respect. And of course they're going to meet with me, not with a nurse first or with a patient handler. I meet with all the patients and we make sure that we give plenty of time for the consultation because in reality not only is the patient choosing me, but I'm also choosing the patient, and I think that's very important for the patient to know. And I think when a patient comes to see me, what they can expect is hopefully as good a communication as possible, because really communicating the expectations and really discussing with them, getting inside their head and making sure I know what they expect is the only way to make sure that they're going to get the result they determine. I think if you ask my patient how they felt after the experience of a procedure in my office, I would expect and hope they would say that they were pleased with the result, they were treated respectfully, and they felt like they were part of a family in our office. Well, I think being a top 10 MD gives some credibility to the qualities and credentials that I have from an outside source. In other words, I can tell you I'm board certified and you can check it, that's true, and I can tell you that I've been doing surgery without any real issues for many years, and you can check that too. But top 10 MD at least can put together a panel of doctors that they have vetted carefully, and I think the public likes an outside source to sometimes vet their doctor. It gives them a little added benefit even though they may do it themselves. So it's just another benefit for the consumer to feel comfortable with at least a basic level of training and education.